Hello, my name's Betty. Today we're going to talk about the mental health crisis in America. Mental illness in the U.S., it's become a crisis. The U.S. has experienced a mental health crisis that is seeing many people struggle with their mental health. America is experiencing more cases of mental illness and substance use disorder. Also, along with this increase is a lack of or access to care. Part of the problem is more people are facing problems related to inflation. They're having to worry about if they're going to have a job or not. And also the immigration problems America are facing also contribute to the crisis. In 2024, 23.8% of adults in the U.S. experienced a mental illness. This is 60 million people who are experiencing some type of mental illness, such as anxiety or depression or ADHD, among other illnesses. The most common disorder is anxiety. This affects 42.5 million Americans. In 2022, just 2 years after the height of the pandemic, the U.S. recorded a record number of suicides. This was estimated at more than 49,000 people we lost. These were somebody's child or sibling or parent. Suicide is the 10th leading cause of death in the U.S. The majority of people in the U.S. with a substance use disorder, they do not receive treatment. Often, it's a result of the high cost for treatment. Many people don't have insurance coverage for mental health and substance use services. This also affects the ability of the youths to get early treatment for mental illness. 1 in 5 youths ages 12 to 17, they experienced at least one major depressive episode last year. More than half of these children did not receive any treatment for their mental illness. The mental health crisis America is facing, it not only affects individuals, but also families. Primary care physicians, they are often the first point of contact for patients with mental health issues. But even then, it can still be a challenge to navigate the healthcare system. Many physicians are the ones to try to treat people with poor mental health. Among other worrying issues is this crisis that nearly 13 million adults had serious thoughts of suicide. In 2019, before the pandemic, cases of suicide, they saw a slight decline. But just 3 years later, in 2022, the highest number ever of suicides was recorded in the U.S. We all know the pandemic had a major effect on people's mental health. However, not just adults are affected. There is still concern for the youth of America. Statistics show that more than 3.4 million youth had serious thoughts of suicide. Substance abuse is also of great concern. It is estimated that more than 45 million adults and 2.3 million youth are experiencing substance abuse problems. We are in a time of crisis. Evidence shows the need for mental health care is urgent. Record number of adults and youth are showing serious thoughts of suicide. Not only has it been a year with a record number of suicides, substance use is also on the rise. There are indications of distress and disparity escalating. Obstacles such as the high cost and a shortage of mental health providers, they are preventing many Americans from getting the help they need. Barriers to obtaining mental health treatment, it exists nationwide. Nearly 6 million adults with a mental illness, they are uninsured. 1 in 4 adults who experienced 14 or more mentally unhealthy days a month, they were unable to see a doctor due to the cost. It doesn't help the situation that we are facing a shortage of mental health providers. It is estimated that for every one mental health care provider, there are 340 people needing treatment. It is evident that in some cases, that in some areas, only 27% of mental health care needs are being met. This is critical that the affordability and availability of mental health care be increased so that people can get the help they need. But this will not completely address why people are experiencing distress in the first place. It is critical that states invest in public health designed to focus on prevention or mental distress and promote well-being. Some of the reasons the U.S. is experiencing a mental health crisis is the rise of social media, the COVID-19 pandemic, and the recession. These events have led to an increased competition, inequity, loneliness, and smaller family units. It's estimated that more than 27 million Americans with a mental illness go untreated. Younger generations, they might not know where to access mental health care. Mental health is very complex, and there are few straightforward answers and solutions. The opioid crisis, it also led to an unheard of mortality rates from drug overdoses. Poor sleep habits are also linked to depression and suicide thoughts. Social media also has a huge impact on mental health. One way is it glamorizes getting a little sleep. And studies have proven how important getting enough sleep is, not only to maintain your physical health, but also your mental health. Lifestyle and biological factors, they can contribute to depression and mortality, but social factors such as poverty, housing, instability, lower education, lower income, and lack of health insurance, they can have a significant impact on mental health. It is estimated that 21 million U.S. adults have had at least one major depressive episode. Research has also shown that the onset of cardiovascular disease occurs an average of 7.5 years earlier in adults with mood disorders. When addressing the root causes of the mental health crisis, it will require that we take into account socioeconomic and other health factors. It will mean tackling much broader social problems. Mental health, it is a state of mental well-being that enables people to cope with the stressors of life. A majority of people in the U.S. believe the country is experiencing a crisis in mental health. Statistics show that 9 out of 10 adults, they believe there is a mental health crisis in the U.S. today. They also believe the opioid epidemic is near the top of mental health problems. 2/3 of Americans believe that the opioid epidemic is at crisis level, not just a problem. Also, mental health issues in children and teenagers has become a crisis. The COVID-19 pandemic worsened many social stressors faced by Americans. We know that these can increase the risk of both substance use and mental illness. Data from the CDC, it shows that drug overdose deaths related to mental illness also was at record levels. In 2021, suicide rates were back near a record high after 2 years of decline. In 2020, mental health visits to ER jumped 31% among teens 12 to 17. Half of adult Americans say that they have had a severe mental illness in their family. This includes in-person treatment for a family member who was a threat to themselves or others. More than 1 in 5 adults said that they were often or always depressed or lonely. A third of adults reported that major stressors in their life contributed to their poor mental health. Some of these stressors included personal finances and current political events. 1 in 4 adults said that some of their major stressors were relationships and work. One of the only benefits of the pandemic was that it caused more acknowledgement and willingness to start talking about their struggles or need of support. This can be a preventable issue, and we all have a part to play. Let's get all Americans the mental health services that they need, because our country is declining. With acute mental health challenges such as loneliness epidemic and a youth mental health crisis, and stressed and overwhelmed families, many Americans have lost friends and families. More than 49,000 Americans died by suicide in 2022, and the numbers, they just keep going up. These are somebody's child or parent or sibling or family or friends. It is alarming when reports show that 13.2 million people seriously thought about suicide over the last decade. Suicide rates have climbed by 16%. This must change. The first step is probably one of the most important steps, and it is to raise awareness. We have to stop and we have to start talking about it if we are ever going to prevent it. One of the reasons the mental health crisis feels stuck, it's because COVID forced Americans to talk about our deteriorating mental health. 4 years later, and the problem hasn't gotten better. Part of the reason is that American healthcare system is not equipped to do much about it. Mental illness is a very complex problem. Stressors of modern life and no straightforward solutions. These are all barriers that we don't really know how to overcome. In most cases, problems are just stuffed under the umbrella of mental health, and this won't be solved by the mental health care system alone. Even though the U.S. has gotten better at measuring the extent of mental health problems, there is still no good strategies for addressing a lot of them. It's not like there's a magic pill that these people with mental health issues can take. The U.S. healthcare system, it doesn't know what to do. The things are being done, they don't have much effect. During the pandemic, we saw the persistence of a youth mental health crisis. Emergency rooms swamped with psychiatric patients and policies that hindered patients from being able to receive help at the same time. Social connections has deteriorated in the U.S. The U.S. hit an all-time low in the rankings of the World Happiness Report this year. Nearly a third of U.S. adults reported being lonely at least once a week, and 10% say that they were lonely every day. The pandemic contributed to smaller families and circles of friends. It also contributed to less socialization. There is a clear link between loneliness and poor mental health. There is also very real epidemic of loneliness and isolation. To start to improve America's mental health crisis, it will be a huge task. In some areas, we are not improving, and in other areas we are. But just throwing potential problems that won't get better with without true solutions, including a much greater investment in social supports. The current status quo, it's not working. Although we have gotten more mental health professionals and access to mental health services has expanded, it's not enough. We need more. The American people have not gotten better. We know individuals are benefiting from these interventions, but from a population standpoint, these interventions have not had a significant effect. Americans view the mental health crisis as a top threat to public health. Hope is that better outcomes are on the way. New ways of handling mental health crises are being implemented. Also, more funding is being put into mental health services, along with more technology. In the past 3 years, access to mental health services has increased, and there has been an increase in prevention. Also, new drugs are being developed, and hope is that this will go a long way in offering different options for patients that have been stuck with the same therapies that were used decades ago. And there is also greater awareness and better understanding that we will match patients with the right treatment. Even though there is increase, there is a lot more to still be done. We are nowhere near getting the funding that needs to be for mental health. The population that is in need of more effective treatment is increasingly caught in a wave of public intolerance for homelessness, drug use, and that has opened the door to causing law enforcement to have to deal with more of the mental health crises without resources or training or social support. If you're trying to get people out of public spaces, that might work, but that doesn't solve the problem. The data shows that the mental health crisis that the U.S. is in is affecting people of all ages. This trend was made worse by the pandemic. Even before the pandemic, depression in America, kids 12 and older, had begun to increase. From 2020 to 2023, 1 in 10 Americans reported experiencing depression. In 2021, there were 5.8 million ER visits for mental health-related illnesses. In addition, deaths from drugs, alcohol, and suicide more than doubled. And it is continuing to rise. This has impacted families and communities, not just socially, but also economically and emotionally, long after they occur. These deaths are often brought on by an underlying mental illness. Young people in the U.S. are being greatly affected by the mental health crisis. 2 out of every 5 high schoolers report that they have struggled with feelings of sadness and feelings of hopelessness. In the 10 years leading up to COVID-19 pandemic, students struggling with these feelings increased by 40%. Youth and young adults between the ages of 10 and 24, they account for 15% of all suicides. That's an increase of 52% since 2000. It has become the second leading cause of death for this age group. How can we allow one more young person to become just another statistic? You may think the mental health crisis doesn't affect you, but it has lasting effects not only on families, but also communities, workplaces, and the economy. It is true that the federal government is working on things to try to improve and address this issue, But with all the funding cuts and things going on, we don't know where it's going to lead. And it has to become a priority. They have to start addressing strategies for mental illness and substance use disorder. Many of the U.S. Surgeon Generals, their current priorities revolve around mental health, including firearm violence, social connection, youth mental health, social media, misleading information, and healthcare worker burnout. Federal agencies under the HHS Substance Abuse and Mental Health Services Administration, they are trying to increase access to treatment and services for those with mental health conditions that impact their daily lives. But like I said, with a lack of funding, it affects more and more people, and they can't get the health care that they need. The CDC also plays a role in improving the mental health crisis by providing public health programs. No one approach can solve the mental health crisis alone. The CDC uses its expertise and data and science to improve mental health outcomes. Public health uses a primary prevention approach to promote positive mental health by trying to prevent mental health conditions before they develop or worsen. The U.S. has reached what it is called peak therapy. Counseling has become food for hot books, podcasts, and movies. Professional athletes, celebrities, and politicians routinely go public with their mental health struggles, and everyone is talking about therapy. Sometimes the information is correct, but often it is not. All of this mainstream awareness is reflected in the data by the federal government. It is estimated that 1 in 8 U.S. adults now take an antidepressant, and 1 in 5 have recently received some type of mental health care. This is an increase to almost 15 million people in treatment since 2000. Even in recent past, from 2019 to 2022, use of mental health services jumped by about 40% among millions of U.S. adults with commercial insurance, according to recent studies. Even as more people are in therapy in the U.S., mental health is getting worse. Suicide rates have risen by about 30% since 2000. That is almost a third of U.S. adults that have symptoms of either depression or anxiety. That's almost 3 times as many as in 2019. And 1 in 25 adults have a serious mental illness, such as bipolar disorder or schizophrenia. As of late 2022, just 31% of U.S. adults considered their mental health excellent. That is a decrease from just 2 decades earlier. Trends are going in the wrong direction. Even as more people seek treatment, unlike cancer, with survival rates have increased, and heart disease survival rates also have increased, there are positive sides to this crisis, such as people are more comfortable seeking care as mental health goes mainstream, and it becomes less of a stigma. But the survival rates aren't getting better. Mental health problems can have a wide range of causes. For a lot of people, it's a combination of things. Some of the factors that can affect mental health include such things as trauma or neglect, childhood abuse, isolation, severe long-term stress, having a long-term physical health condition, unemployment, homelessness, alcohol or drug misuse. These are just some of the things that can affect mental health. Sometimes mental health problems are run in families, such as schizophrenia. Reports have been released that shows the need of interventions to prevent mental health disorders. advocates, they are pushing for expanded insurance coverage, including for mental health and substance use services, and the use of telehealth to increase accessibility. We need to hire and train more mental health professionals. We need open dialogue and education to reduce the stigma and encourage individuals to seek help. We need to ensure that all groups have fair access to mental health care. There are new digital tools and new therapies to help improve mental health care that need to be implemented. Workplace stress and burnout, they are at an all-time high. More companies, they are starting to implement mental health programs and policies to support the well-being of their employees, but they still have a long way to go. Even though mental health awareness is growing and progress is being made, the mental health crisis in the U.S. remains a significant challenge. Addressing the crisis requires tackling both the immediate needs of individuals and other factors that contribute to the problem. The mental health crisis in the U.S., it isn't slowing down. 1 in 4 adults have experienced a mental health illness in the past year, and 13 million people had serious thoughts of suicide. But even though awareness is growing and more people than ever before are prioritizing their mental health, we still need to stand and fight for better mental health care. One of the biggest in mental health care is access to immediate support. Long wait times to see a therapist or psychiatrist, it often leads people with no choice but to go to the ER for help. Substance Abuse and Mental Health Services Administration introduced in 2025 the National Guidelines for Behavioral Health Coordinated System of Crisis Care. This is to help make mental health crisis care more accessible. One way is by expanding the 988 Suicide and Crisis Lifeline to provide immediate support. Another way is to increase mobile crisis teams to help bring mental health professionals directly to people in distress. Also helping to make sure emergency mental health services are available to all communities. This means that people can get the right help at the right time without relying on emergency rooms that are already overwhelmed. Although progress is happening, there are still barriers that make mental health care accessibility hard to reach for many people. Some of the biggest challenges are long wait times for therapy and psychiatric care, workplace stress, and the stigma of mental health illness. Some experts believe that mental health care needs to be integrated into primary care. More companies are realizing how important the mental health of their employees are, so they are starting to offer benefits like help paying for therapy, flexible work hours, and mental health days. But still, mental health issues have increased in the workplace, and this affects women more. They are experiencing stress, burnout, and anxiety. This has increased since the pandemic, leading to a rise in mental health-related leave of absences. In 2024, research found that 11% of all employee leave was for mental health. This was an increase of 22% from 2023, and women accounted for 71% of those leaves. Also reported was that 57% of workers faced burnout, and 75% of them were women. Some factors that have contributed to this crisis include high inflation, political tension, and longer work hours. Society teaches that women aren't supposed to discuss their mental health struggles. Some of the things employers are doing to help address this is offering childcare benefits and fertility benefits, and some are considering menopause support in the coming years. Pay equity, it's another critical factor. It is stated that women earn approximately 83 cents for every dollar men make, and this contributes to the stress many female workers have. Research has shown that many women and people of color do not earn a livable wage, which contributes to their mental health struggles. Investing in mental health resources is not only a moral obligation for companies, but also a strategic business move. Some things that have caused the decline in mental health: the pandemic did take a toll on everyone's mental health, and it has been difficult to manage the lasting effects of COVID on mental health. The loneliness and isolation and worrying about loved ones increased people's anxiety and depression. People who suffered loss during that time report that those negative feelings still remain today. Even though the mental health crisis has worsened, awareness of mental health issues have grown. It has led to increased reporting of mental health struggles and make it possible for more people to get help. It's also become less stigmatized and helps people often to open up about their struggles. Some other triggers of mental health struggles are the rising cost of living, causing financial issues, professional burnout, political discourse, and shocking, frightening world events. Besides acknowledging your own struggles, you can also help improve the mental health crisis in your community. One way is to listen. By listening and acknowledging your own thoughts and feelings, as well as others, by doing this, you can recognize when others need help, whether that means making lifestyle adjustments to manage anxiety or giving your friend a safe space to vent about their thoughts. Listening is very important. Another way to make an impact in your community is by starting or participating in support groups. Another way is to educate yourself and others about mental health issues to help reduce the stigma surrounding mental health. You can advocate for accessible mental health resources for everyone. Speak up to help stop the stigmatization surrounded by mental illness. Encourage conversations about mental health. Even though it might seem hopeless, getting the right treatment can help to improve a person's mental health. Change is possible. But we also have reports that show the mental health of new mothers is getting worse. In recent years, there has been a decline in maternal mental health due to social and economic pressures. One of the biggest factors causing the decline in mothers' mental health is a lack of federally funded, mandated parental leave, along with policies that oppress low-income mothers. America is the only industrialized country without mandated parental leave. Mothers in Sweden, they get 480 days of paid maternal leave. The UK provides up to 39 weeks of partial paid leave. In the US, it is 12 weeks of unpaid leave called family medical leave. And only about 40% of workers are eligible workers. Addressing this problem, more than just new laws need to happen. We need to have access to paid leave. Affordable child care and postpartum mental health care needs to expand. We have to change society planning that parenting rests solely on the mother. Fathers need parental leave also. Studies showed when fathers were able to have parental leave also, mental health outcomes improved. Prescriptions for anxiety dropped, hospitalizations fell, and antibiotic use decreased. Mental health improves when both parents can be involved in caregiving. In the U.S., childcare has become unaffordable, which contributes to the decline of the mother's mental health. In the U.S., childcare costs are more than many public college tuitions. In low-income families, and especially single mothers, childcare costs are 75% of their income. Despite this, the 2026 budget proposal cut suggests $750 million cut from Head Start programs, which could take services away from 80,000 children across the U.S. This bill will hurt rural and low-income communities the hardest. This is one of the few services mothers have for early education, nutrition, and mental health care. Government programs are not enough. This hurts marginalized communities. They suffer from inadequate mental health support and job insecurity, leaving many low-income mothers without access to consistent, competent care. Job insecurity worsens the crisis because many moms work low-wage, unstable jobs with no paid leave and unpredictable hours. Society expects women to do it all, to be fully present and a nurturing mother, while also working as if they don't have children. Yet society offers very little support. The pressure is relentless and not only exhausting, but it can be deadly. According to the CDC, 20% of maternal deaths in the U.S. are due to suicide. This shows how badly we are failing our mothers. We must demand policies that support paid leave, equitable health care, and affordable child care. The way mental health is discussed in society has evolved significantly, which has had both positive and unintended consequences. On the one hand, greater public conversation has reduced the stigma and has encouraged people to seek help and validating their experiences. On the other hand, it has reshaped how emotional struggles are perceived and reported. Challenges that might have been considered just normal ups and downs of life, they're now more likely to be classified as mental health problems. To fix the mental health crisis, some things that need to be done is increasing telehealth options, evaluating and utilizing mental health apps, and invest in commonly based programs. Additionally, focusing on prevention through education and early intervention, as well as ensuring equitable access for everyone. These are crucial things that need to be done to help fix the crisis. But remember, we are in a crisis, and it is up to all of us to do our part to help fix it. We have to start talking about it. We have to stop the stigma surrounding mental health. Thank you for joining me once again.